last session of the day, best practices in tender documentation and bidding processes. I would like to invite to the stage Dr. Mazen Al-Zaben. He's the country manager for tenders and market access for Hikma Pharmaceuticals. With over 16 years of experience at Hikma Pharmaceuticals, he has developed a deep expertise in the pharmaceutical industry across the MENA region. His background is in pharmacy and business, and it enables him to drive growth, optimize market opportunities, and enhance access to essential medicines. He has a proven track record in sales, marketing, and institutional business, specializing in both private and public sectors. This diverse experience allows him to navigate a complex market and contribute to corporate growth while advancing broader healthcare goals. All the way from Jordan, please help me welcome Dr. Mazen.
Hello, everyone. We're talking now today about the documentation and process of tendering. And in today's competitive landscape and the new trends of technology and documentation and everything going around, we will be hearing from our esteemed guests about the documentation and the bidding processes. So we will hear from Mr. Anas Darwish and Dr. Nermeen Ashoush. Mr. Anas Muhammad Darwish is a senior professional in the field of marketing, holding a Master of Science degree from the UK, currently serving as a tender and contract supervisor at Advanced Technology Company in Kuwait. He brings a wealth of expertise in navigating the landscape of business contracts, tendering and procurement process, with a passion for strategic marketing and a keen eye for detail. So allow me to welcome Mr. Anas for his presentation.
Thank you, Dr. Mazen. It's a pleasure to be here today to talk about a topic that it's curricular to the healthcare industry. My name is Anas Darwish, and I serve in Advanced Technology Company as a tender and contract supervisor. The healthcare tendering process plays a vital role in ensuring that medical facilities acquire high-quality product and serve in a cost-effective, transparent, and compliant manner. Today, we will explore that the key steps in the healthcare tender process, identify the best practice, and discuss challenges along with their solutions. Before to dive into the topic, I will give you a little summary about my company, Advanced Technology Company. It is the main player and the biggest leader in Kuwait healthcare market. We are representing more than 350 manufacturers all around the world, and medical equipment and healthcare solution. And my company is focusing more and giving much investment in medical equipment, turnkey project, IT solutions, kitchens, and central laundry projects than pharmaceutical solution and medicines. Before diving into the process, we have to ask why our health tender is important. Let's first understand why healthcare tender is a matter. It is the first point is about cost-effective procurement. By selecting the most suitable supplier, we ensure that the hospitals and healthcare provider receive the best value for their investment. The second point is about the impact on healthcare or patient care. The quality of the medical product and services directly affect patient treatment outcomes. The third point is about transparency and accountability. A well-structured tendering process minimizes corruption and ensure ethical procurement. The fourth point is encouraging supplier competitive. Open and fair competitions lead to better pricing improvement, service quality, and innovations. The main objective for this presentation is to speak about, to understand the tender process and its key components, identify the best practice that enhance efficiency and compliance, minimize risk associated with procurement, failure, and regularity violation. To take a quick overview for the tendering document processing, starting from the RFP document till the contract terms and compliance requirement. This steps starting from invitations to the tender, then how to transfer this invitation to opportunity, and how to start from the opportunity to tendering process. Then the scope of work and the eligibility and the qualification criteria. The fourth point is the evaluation and selection process. The fifth point, it's finishing with the contract and compliance requirement. Now, if we want to talk about the scope of work and technical specification, we need to, when we have to start the tendering process, we need to have a clear and detailed requirement, like to have the full knowledge about what the customer need, what the client need, what the hospital is looking for, what the minimum requirement. The second point is the compliance with industry standard. You know, I don't know, in Kuwait, they are not accepting any document or any product without FDA, CE, and ISO certificate. To talk about the eligibility and the qualification criteria, here we have three main points. It's about supplier financial stability. The second point is legal and regulatory compliance. The third point is technical and operational capacity. Evaluation and selection criteria. In Kuwait, they are looking always for the lowest price, but here the lowest price is the first option to start studying the tender. It's not a must to award the tender for the lowest price. So if the company failed to comply the tender requirement or the client requirement, they will start another criteria what they call the quality of the product, and then they will jump to the compliance. And every one for this criteria or from these elements, it's having a weight, depends on each tender, and they give every weight a percentage. And the bidder who's the one who is scoring the highest percentage. Contracts, term and condition. Here we will talk about the delivery timelines and penalties. I think you know is the contract is apart from the tender document. Once you receive the tender document, you have to be aware once you sign or submit your bid, you are agreed 100% in the contract terms also. For us to get this as a best practice, this part is taking care about legal division. So once we reached to this part, the legal divisions, they get involved in this and they're giving us their feedback. Regulatory compliance and consideration. Patient safety is the most important things before anything, and data protection, regulatory framework, and ethical sourcing and environmental standard. We will dive into the sixth step of the tendering documentation. The first one is the pre-tendering planning. To understand more about the tender, we have to be engaged from the first step of the tender, which is the pre-tender planning. Here, the client will looking for the product or the project he's aiming for. Now it's a main part of our work to get involved in this step. by making the marketing research, by taking the budget approval, helping the client to put the correct budget for their product, for their aiming project, or for aiming whatever they are looking for. The third point is identifying the procurement needs. Step 2 is tender publication and supplier engagement. Here we need to be aware that there are many suppliers, they are working in the same product line. And too many of them, there is they are engaging in the same product with the same specification. How to choose the correct supplier and how to decide which supplier we will go. Many tender in medical field, they have conflict item. Like if company X company code for monitor, the Z company will code for monitor also. Now it's apart from our job to be aware and decide for which company we should go. This step, it is very, very critical, because at the end you have to give clarification to the X supplier if you didn't choose his item, or for the Z supplier if you didn't go with his product. And this is a part of ensuring transparency and fairness. Reaching to step 3 for bid submission and compliance check. Common mistakes in bid submission. During this years, I found out there are many mistakes the tender officer or the tender coordinator, they are facing it. The main three mistakes is a missing document. Each paper is important. Each details is important. Sometimes we get disqualified from tender because we didn't write the tender subject correctly, or we mentioned a wrong year, or we closed the envelope correctly. Any silly mistake, something you feel it's a silly mistake, but for the authorities and for the government body, it's a big things. Whenever they say it, they will disqualify you, or they find you didn't provide the correct paper. Incorrect formatting, especially with online tendering. Now, the oil sector in Kuwait, they are 100% online. There are some forms, it's a print out after you submitting. This formatting, if you don't have the correct tools, if you don't have the correct formatting, the correct software, and you print it like it's in one page, and you print it in 2 pages, you will be disqualified, because everything they have for that, they have a system can't read all this formatting. It could easily disqualify you. And the late submission. Late submission is critical. Late submission is very common mistake. It's not only late submission for the tender envelope, it's late submission for the offer, late submission for the catalogs, for the supporting document, for the whatever is there, whatever the tender is need. Late submission is not only for the tender officer, no. Late submission starts from the deadline for the sales, for the product specialist. Step 4 is about the bid evaluation and shortlisting. It's a cross-functional for evaluation panels. This cross-function, it is the people who's involved in this tender, they have to sit together and study what they submit, why we didn't win the tender, or why we won the tender, and how we can go for the future. Each and every tender, we implement a system. It's giving feedback, starting with a bid result. Why I am the lowest price, why I am the highest price, how many tenders I won, and each step, the stakeholder have to give his input, his clarification why it's happened, if it's correct or not correct. And for this case, the best use is to make scoring sheets. Here, the scoring sheets is helping you to identify more and know more, getting more details about your current situation. Step 5 is awarding and contract management. Performance monitoring and KPI tracking, supplier relation management, and managing disputes and contract amendments. Post-tender and post-tender review and continuous improvement. This is also the same tools I explained before. It is going further in deep details to reach the lesson learned from this tender. Here, my company, they are using these tools to monitor the sales, monitor also the sales person behavior and his experience. Like if he quote like 10 tenders per year and overall to this tender he only get one. So why he get one? Why not 5? Why not 6? Why there is no improvement? All these tools and this documentation, it is putting a very, very important database for each tender. The challenges we have in tender documentation, it is starting from lack of a clear specification. Sometimes in medical equipment, the companies providing the client the specification, of course without any name, because it's like a doctor needs. The doctors sometimes they prefer some products over the other products, so they give priority to whatever they need. And when they announce it, they will announce it as a general specification. This general specification sometimes lead you to wrong response or wrong quotation or wrong offer. This is one of the most challenges we face in tendering submission. Here, the second challenge is supplier collusions and fraud risk. Risk is price fixing or bid rating. The price fixing, the minimum time the authorities or the government body is taking to study the tender is 2 years, and you keep your price validity for 2 years. There is too much risk. There is too much challenges you face. These things need you to study hard your pricing before you submit your offer. The solution here is implement anti-corruption policies, and always you have to make supplier audit. This is starting from the date when you sign your agreement with the supplier. He has to know your tendering process and how the internal process is going on. The third challenge is the delays in procurement cycle. The causes is it's all about the supplier issue. Supplier mainly they change the companies. We talk here about the local agents module and the distribution module. Same what we are facing in my company. They are always shifting from between companies. Once they didn't reach their set target, if they have any problem, they will shift you. They will terminate this company and go to other company. The mainly procurement delay or mainly problem with procurement is the supplying. When you sign a contract or when you submit a tender, then they cannot provide you the product, or they will say sorry. This is all risk in you, And this will guide you to very critical penalties it will cause, because of the government. They will not let you escape like this easily. So before you start the bidding process, you have to be sure the supplier is suitable, the supplier is ethical, and he's with you for minimum 3-4 years in this tender. The best solution for this is to digitalize procurement and system and automation. The AI, to put the tools you need, how to control these things. Challenge number 4 is the budget overness and cost control. Here, we have a big difference in Kuwait than the other countries. They called Mubarasa and Munaqasa and RFQ and RFB and budgetary and single source. Mubarasa for everything less than 75,000. Once the Mubarasa is going above 75,000, it have to go to different authority, to different government body. Then you have to start a new process, a new era of audit. The company itself, they are trying hard to keep their money, keep their budget until 75,000, so we will not go to that step. Here there are too much risk about the challenge we face up. It's about the pricing audit, pricing validity, price fixtures also. The fifth challenge is regulatory compliance issues. It's risky violating healthcare laws. The solution we need to implement is regular compliance training and audit for all the people who's working in tender. In the end, I want to thank you, and thank you, Dr. Mazen.
Thank you, Mr. Anas, for your comprehensive presentation. And now, allow me to welcome, unfortunately, Dr. Nermeen Ashoush couldn't make it personally, but we will have her virtually. Dr. Nermeen Ashoush is the Health Economics Outcomes Research Associate Director for the Middle East and the Africa region at Amgen. Prior to this, she was an Associate Professor of Health Economics and Health Policy at the British University in Egypt, where she also founded and led the Health Economics Unit at the Center of Drug Research Development. She has also served as a professor at the University of South Wales at UK, teaching in their postgraduate health economics master's program. Dr. Ashoush has published extensively in prominent clinical pharmacy and health economics journals, co-authorized a textbook on market access, pharmaceutical pricing and healthcare cost, and is a frequent speaker at workshops and international conferences on health economics and outcomes research in the Middle East and the Africa region. Welcome, Dr. Nermeen.
Thank you so much, Dr. Mazen, for introducing me. Good afternoon, everyone. Can you hear me well?
Yes, we can hear you, yes.
Thank you. So I'm going to share my screen now. So today I'm going to talk about value-based procurement. And as you all know, in the recent decades, the healthcare system around the globe have been transitioning from utilization-based models that emphasize volume to a marketplace focused on impact and value. So now the mindset completely changed from evaluating innovative medication, not only the pharmaceuticals or the innovative product, but also any kind of healthcare technology, the mindset completely shifted from evaluating the health technology based on price to value-based procurement. So today I'm going to share the best practice for tender documentation and bidding process by applying multi-criteria decision analysis for healthcare decision-making. Whether I'm talking about tendering, procurement, formulary listing, or reimbursement. So just let me give you an introduction concerning the situation at the time being across the Middle East. In order to achieve market efficiency in the healthcare system, there must be a balance between the demand and the supply for the healthcare resources. But actually, the situation in some countries across the Middle East is that we do not have a balance between the demand and the supply. But the situation is that there is an increase in the demand and low supply. The increase in the demand, as you all know, there is an increase in the budget of the pharma companies on research and development. So every now and then there is a new novel treatment to a disease. And definitely there is an increase in the expectation from the public that they want to get access to the medication that will provide the maximum benefit. Also, at the time being, there is an increase in the screening awareness. And as you all know, across the Middle East countries, aging population increase. All these factors increase the demand for the healthcare resources. What about the supply? We still have a budget constraints, even if you have a country that already have a budget for the healthcare system, but they are still pushing for controlling cost and price. And some other countries, they have a limited budget. Why I'm saying inefficiency of the system? Still not all the countries are putting a fixed framework for the tendering process. And as Dr. Anas mentioned, some of the countries that already have a budget, they are still looking for the medication or the healthcare technology of a low price to win the tender. So today we want to solve this issue, to have a fixed framework or to have an evidence-based framework that is matching with the Middle East countries in order to avoid the cost-only approach that will have a risk on the supply chain, as Dr. Anas mentioned. It will have an impact on the physician choice and definitely the country position as innovator in life sciences, whether we are talking about, for example, Saudi Arabia, the Gulf countries, and so on. Now the new era is not only health economics. The era is health policy or drug policy to shape the policy of the healthcare system for selecting the healthcare technology that will provide the maximum benefit to the patient within the financial resources or the budget in each country. So how we can overcome the imbalance between the drug supply and demand, and also to provide and improve access to innovation, and how we are going to establish a framework for the tendering process that encourage market participation, support long-term innovation, and serve the broader health ecosystem that can cultivate a more stable pharmaceutical environment simply by applying drug policy reshaping, evidence-based tendering process, so that to have a transparent criteria for evaluating the innovative medication and not only taking costs as the most important parameter for decision making. Now we want to create a health policy or an HTA concept for the pharmaceuticals in emerging markets. Most of the emerging markets now, they are on the move to universal healthcare coverage. And as you all know, if we are talking about universal healthcare coverage, we need to enroll more patients, provide better benefit, and reduce patients' co-payment. So the priorities across the Middle East is that we want to expand coverage. And definitely that will expand funding. And definitely it will put a pressure on the budget because we want to improve access to innovation, improve equity, efficiency, and quality of the healthcare system. So as I mentioned, the challenges is that we are going to have a pressure on the healthcare budget, increase in the demand, increase in the utilization. Now, every now and then across the Middle East countries, there is a change in the priority diseases. Lack of equity, quality of the medicine, supply reliability, which is a very important factor, as Dr. Anas mentioned. So now if we want to improve access to innovative medication and we expand coverage, that will lead to increase in the cost. So now we want to have a drug policy, evidence-based, matching with the regulations across the Middle East countries in order to ensure maximum outcomes, but at the same time, at a minimum cost. So in order to limit the need for an additional funding required for public health to the minimum, it's very important to have a pharmaceutical policy that will help us to meet our priorities across the Middle East countries by ensuring maximum health outcomes, but at the same time, minimum waste of resources. And as you all know, if we are going to put a price or cost as the only factor for decision making, we are wasting our budget, not saving our budget. So if we want to have a drug policy, a rational and comprehensive decision-making, evidence-based decision-making, as you all know, now we are moving to value-based healthcare. It's very important for all the key stakeholders. Definitely, if I'm putting patients number one, they will get access to the innovative medication. Healthcare professionals, they will focus on the clinical part of their job, because sometimes when we focus on cost for the tendering process, there is a huge shortage for the drug supply. And definitely we will discuss this part later on. Policymakers, it's very important to have an evidence-based methodology for the tender, because definitely they will reach their health policy objectives by having a benchmark for the criteria for evaluating pharmaceuticals during tendering, procurement, formulary, listing, or reimbursement. And definitely the pharma companies, if they know quite well the criteria for evaluation and transparency, instead of focusing on price, that will improve the competition between the pharma companies to provide the maximum service that they can in order to win the tender. So we need to have a clear criteria for evaluating the pharmaceutical products and to be transparent in each country and even to be published. So we need an evidence-based methodology for evaluating the pharmaceuticals in the emerging markets in order to deliver effective, universal, and efficient healthcare, which is an important policy goal in many emerging markets. So we need a robust methodology for the pharmaceuticals. And by the way, MCDA, or multi-criteria decision analysis, that I'm going to discuss with you, we should have a fixed criteria for evaluating the pharmaceutical products in each country, devices, and some countries already started to publish the criteria for evaluation, whether we are talking about tendering, procurement, or formulary listing. By the way, multi-criteria decision analysis, they started to talk about it during the ISPOR International Conference since 2015. And a lot of publications have been published regarding the application of multi-criteria decision analysis. And by the way, in Saudi Arabia, they applied or they published multi-criteria decision analysis as a tool for evaluating the orphan medications. So we are encouraging the policymakers across each country in the Middle East region to start publishing the criteria for evaluating the pharmaceutical products for decision making. If we are talking about cost-only approach for tendering, definitely it will have negative consequences if we took the price as the only factor for evaluation. Whether we are talking about the product level, we will find that if you are going to choose the medication of a lower price, it will not provide the benefit to the patient in some cases. We can find drug resistance, side effects, and sometimes lack of equivalence. And on the manufacturer level, sometimes if you go to the medication of a low price, we will find also some negative challenges if we are talking on the manufacturer level, service level, economic level. And as I told you, if we go to the medication that is lower in price or took it as the sole factor for evaluation, definitely it will have a negative consequences on the patient. And by the way, sometimes the patient, they do not achieve the outcome benefit. So that will cause a long treatment duration, increase the comorbidity and mortality, and at the end, it will lead to high treatment costs. So now we are focusing on shifting the mindset from a price-based decision-making to value-based multi-criteria decision analysis. Maybe 2 days ago, I was in a conference in Saudi Arabia. Now we are talking about the implementation, and already it's implemented in Saudi Arabia, HTA, Health Technology Assessment. And sometimes the medication is cost-effective and budget saving. But when you are talking in a certain account, they found that the innovative medication, even if it's cost-effective and budget saving, because the outcome benefit are transformed to monetary saving, they found that this innovative medication posing a budget pressure. So that's why Saudi Arabia, they started to take in consideration, in addition to the economic evaluation, other criteria for evaluation, supply reliability of the company, evaluating the manufacturer, the services provided by the pharmaceutical companies, the product outcome benefit, in addition to the economic evaluation. So we need to move all together, all the Middle East countries, by not only taking the costs as a sole factor for evaluation. Why I am talking or discussing the multi-criteria decision analysis? MCDA, by definition, it's a methodology, evidence-based approach. It helps decision makers because decision here is not based on one criteria, not based on price. MCDA, it make it explicit the impact on the decision if we took in consideration evaluating the manufacturer, product, services, and the economic factor, all different criteria, and showing the relative importance that is attached to each criteria for healthcare decision-making. Sometimes when we take an evidence-based policy, it's not suitable for all the countries due to the difference in the healthcare development status, priorities, and budget. But the good part of the MCDA is that it's adaptable based on each country healthcare system status and priority. Because as simple as that, in each country, they are going to run like meetings and workshops in order to determine with the key stakeholders what are the criteria that is suitable for each country based on their healthcare status and priorities in order to evaluate the innovative medication. So definitely, by applying MCDA, it will improve the decision consistency and transparency across the countries. How MCDA have been used globally? If I'm talking about Colombia, they developed MCDA for health technology assessment. Even in Italy, they started to apply MCDA for the introduction and the delisting of health technology. Even if I'm talking about Hungary, they used it for evaluating any new hospital medical technology, pharmaceuticals, devices, everything. Russia, they also started to apply MCDA for the orphan medications because, as you all know, we cannot apply economic evaluation, cost effectiveness, and budget impact analysis when we are evaluating rare diseases. So they started to apply MCDA for orphan medication, and even in Saudi Arabia, which is leading the way for evaluating the rare diseases and not relying on the economic evaluation. Because definitely orphan diseases or orphan medications, high in price, treating small number of patients, definitely it will not be cost effective. This is not because the orphan medications are priced high. That's because it's used for rare diseases, so we cannot evaluate by using economic models. So we started to apply MCDA for rare diseases, even for the biosimilars. So MCDA, it's suitable for evaluating the innovative medication. And as I told you, we have a lot of publications regarding the application of MCDA for decision-making. So MCDA, it has two principal issues. It aggregates dissimilar types of benefits for the new healthcare technology in order to define the decision rule to decide whether the quantum of benefit that we are going to take generated from a given quantum of budget invested for getting this innovative medication, it constitutes an acceptable value for money or not. How we are going to apply the MCDA? Let me tell you in a very brief, because we applied it in different countries. Usually we were assessing the medication on a traditional value elements, which is the safety, efficacy, impact on mortality, direct cost offset. And then we have an incremental value elements like adherence, compliance, tolerability, quality of life, productivity of the patient. Now we have a new value elements. We started to talk about unmet medical needs, level of innovation, potential future indication, quality of the product. That's if I'm talking about evaluating the drug benefit. What about the pharmaceuticals or the manufacturer? We need to evaluate the supply reliability, as Dr. Anas mentioned, to avoid the drug shortage. Now we have something called the local investment, local production, the local employment, the local content. We need to measure the local participation of the pharma companies for each country. We need to address the real-life patient adherence and persistence to the medication, bioequivalence, quality control, and assurance. So we have a multiple criteria beside the price of the medication. How we are going to aggregate all these criteria in a one framework? So let me show it to you. We started delivering several workshops about the MCDA in different countries. In order to evaluate, let me focus today on the pharmaceutical products. We need to run a workshop with the key stakeholders in each country, as I told you, because the criteria differ from one country to another based on the healthcare system status and priorities, and to start putting criteria not only on the product level, but on the manufacturer level, services provided by the manufacturer, and the economic criteria. Let me share some criteria. If I'm talking on the product level, I need to assess the level of interchangeability, the bioequivalence, the real-life patient outcomes for the manufacturer, the supply reliability of the manufacturer, services, value-added services provided by the manufacturer, a lot of criteria that we can address based on the law of tender for the most of the Middle East countries when we are evaluating the technical part beside the financial part. So first of all, we need to put like 8 to 10 maximum, not more than 10 criteria for not only evaluating the product, but taking in consideration the manufacturer services and economic criteria. And to start putting like a weight, just to show you the steps, to put a weight on each criteria, the weight representing the importance of each criteria for decision making. Each weight that we are going to put should not exceed 15 to 20%. And the sum of weight on all the criteria should be equal to 100%. That's why I'm telling you it's better to put from 8 to 10 criteria for evaluating the pharmaceuticals in the tendering process. And when I put the weight should reflect the importance of each criteria for decision-making, for procurement or tendering. The sum of the weight that we put on each criteria should be equal to 100%. Now I have a different drug alternatives for the tendering process. What I'm going to do, as Dr. Anas mentioned, but not in more details, that we are going to put a score for each drug alternative, measuring the performance of each drug for each criteria that we put for the tendering process. The score should be on a Likert scale from 1 to 5, from 1 to 10. The stakeholders responsible for the tendering process, they are going to put the Likert scale in order to measure the performance. They are going to give, for example, 5 for the high performance, 1 for the low performance. And then they are going to calculate something called total aggregate score by multiplying the weight with the score of each drug that they got during measuring the performance on each criteria. And you are going to sum up the results of the score multiplied by the weight. In this case, we evaluated technically all the innovative medication on multiple criteria, taking in consideration the importance of each criteria for the decision-making process or the decision makers in the tendering process. Here, I'm not relying on a one criteria. If the product passed the cut-off value for the technical evaluation, which is usually from 70 to 75%, in this case, they are going to move to the financial evaluation. In the financial evaluation, you are going to divide the total aggregate score that the innovative medication got during the technical evaluation by the price submitted by the pharma company, and the drug that is going to win the tender is the one that will provide the lowest results. In this case, you took in consideration the value of the product during the technical evaluation based on the law of tender, and in addition, you take in consideration the price. So in this case, price is not the sole factor for the tendering process. As you can see, based on the Middle East countries' law of tender, and that we should go into technical and financial evaluation, that's why when we consider the MCDE, we divide the total aggregate score by the price, or vice versa, the price by the total aggregate score. In case that I'm going to divide the price by the total aggregate score that the innovative medication got in the technical evaluation, the product that will win the tender is the one that will provide the lowest results of this equation. What is the positive benefits of the MCDE? Transparency, as simple as that, because the tender process, transparency of the criteria for evaluation, and definitely if we moved from cost or price to value-based tender, that's for the sake of patients to get access to innovative medication. Also, the positive benefits of the value-based MCDE is the sustainability across the Middle East countries, because as simple as that, you are the one who put the criteria for the technical evaluation. And by the way, it's not fixed. In one country, they applied it, for example, in Egypt, they applied it. Saudi, they started a bit to take it in consideration, but still driven by the price. So if we have a clear criteria for each country, sustainability of this methodology, because sometimes you can amend the criteria from one tender to another, because it's easy to adapt based on the national healthcare system priorities and the stage of the healthcare system development. So, my recommendation at the end of my presentation, we need to have a transparent methodology for tendering and to move from price to value for the sake of patients, for continuous access to innovation, to ensure the value-based healthcare decision-making. Thank you so much. And now I am ready to take all your questions.
Thank you, Dr. Nermeen.
Thank you so much.
Thank you for your comprehensive presentation. And now I would like to ask Dr. Anas, start with Dr. Anas with some questions. Dr. Anas, in your opinion, what is the best practices for pre-tender planning and medical tender processes, and how this practice could help in best bidding procedures?
Thank you, Dr. Mazen. I believe the best practice in pre-tender planning, it is the needs assessment or needs studying. What's the client's needs? What's the client's requirements? What's the minimum specifications? The next step is market research. The market research is starting from your competitive, your price, and who's the main player in this tender. The third is the regulatory and compliance. You have to study well your product. You have to be sure your product is comply and they are in line with the local regulatory. And the fourth one is I believe it's the budget. You have to understand every tender is built on budget. Don't try to exceed it, and don't try to go too much under the budget. Both sides is risky. Maybe it cause you lost the tender or you win the tender.
So, taking all of what you said in consideration, let's talk about the common mistakes in bid submission and how to avoid the incorrect formatting in bidding.
See, the common mistake, as I explained, it's coming from the lack of understanding the tender itself. The first step to avoid is read the instruction carefully. You assign a team to read the instruction for this tender. The second is to use the provided template. Each tender, there is a different template, different documentation, different ways to close, different forms to fill. It is starting from also adhere the page limit, use the correct formatting, timeline management, put a specific timeline for you to finish the tender requirements, to finish all the documentation, reply all the question, if there is a questionnaire, everything in the tender published, or everything in the tender announcement, you have to be care about it. It's really critical details, and sometimes it could let you lose the tender.
Thank you, Dr. Anas.
Thank you, Dr. Anas.
Now I would like to ask Dr. Nermeen. Dr. Nermeen, you mentioned a lot about the MCDA and the multi-criteria decision analysis. I would like to ask you about what are the challenges in developed procurement systems, and what are the negative consequences of single award tenders?
Okay, thank you for your question. What are the challenges in the developed and also in the Middle East countries? Supply shortage. It's a recurring issue across the geography and product groups, and it's being addressed in the developed procurement system in various methods. Now they are including alternative tender models, mixed tenders. The one that I'm really recommending across the Middle East countries is not to rely on a single winner, but a multiple winner tendering process. Because supply chain, as I told you, it's a recurring challenge in pharmaceutical tendering system. If I'm talking about the developed one, like Germany, Italy, France, where they have been using the single winner approach, it has several vulnerabilities and challenges. So that's why if I'm talking about France, for example, they moved from a single winner, a winner takes all, to multiple winner. In this case, you will ensure a continuous supply reliability. Also, if I'm talking about France specifically, to ensure the continuous supply, they started to enforce obligations and sanctions for the pharmaceutical companies and the pharmacy wholesalers. And also, if I'm talking another example for a developed country, if I'm talking about Greece, in order to face the challenges and the shortage for the medication, they moved from a single supplier model to a 3-supplier model since 2014. So my main recommendation is that we need to focus on 2 things. Not to take cost as a single factor for evaluation, to overcome and to ensure continuous supply reliability for the medication, and also to ensure continuous supply and no shortage for the medication, not only rely on a single winner, but a multiple winner tendering approach.
Thank you, Dr. Nermeen. Now we will leave the floor for any questions from the audience. If anyone have any question. Maybe no one have any questions. And since your both presentations were comprehensive and clear, and for me, I took a lot of good ideas from it for the future of tendering. Thank you, Dr. Anas and Dr. Nermeen, for your presentations.
Thank you. Thank you, Dr. Mazen.